This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is Marfan syndrome? Answer: Marfan syndrome is an autosomal dominant connective tissue disorder that affects the skeleton, heart, and eyes. Question: What causes Marfan syndrome? Answer: Marfan syndrome is caused by a FBN1 gene mutation on chromosome 15 that results in defective fibrillin 1, a glycoprotein that forms a sheath around elastin and sequesters TGF-β. Question: What are the common physical findings of Marfan syndrome? Answer: Physical findings of Marfan syndrome include being tall with long extremities, chest wall deformity, hypermobile joints, long, tapering fingers and toes, cystic medial necrosis of the aorta. Question: What are the potential complications of Marfan syndrome? Answer: Complications of Marfan syndrome include aortic root aneurysm rupture or dissection, mitral valve prolapse, and increased risk of spontaneous pneumothorax, which are most common cause of death. Question: How is Marfan syndrome diagnosed? Answer: Marfan syndrome is diagnosed based on a combination of physical characteristics, family history, and genetic testing. Question: What kind of treatment options are available for Marfan syndrome? Answer: Treatment options for Marfan syndrome include medications to control symptoms, surgery to repair or replace damaged heart valves or to correct chest wall deformities, and regular monitoring for aortic dilation or aneurysms. Question: How does Marfan syndrome affect the eyes? Answer: Marfan syndrome can affect the eyes by causing dislocated lenses, which can lead to severe nearsightedness and increased risk of retinal detachment. Question: Are there any lifestyle changes that can help manage Marfan syndrome? Answer: Lifestyle changes that can help manage Marfan syndrome include avoiding contact sports and other activities that could cause injury to the chest, avoiding heavy lifting, and maintaining a healthy diet and exercise routine. Question: What is the life expectancy of people with Marfan syndrome? Answer: The life expectancy of people with Marfan syndrome varies depending on the severity of the condition and how well it is managed. With proper treatment and monitoring, many people with Marfan syndrome can lead normal lives. However, the risk of death from aortic dissection or aneurysm is increased. Question: Is Marfan syndrome more common in any specific ethnic group? Answer: Marfan syndrome affects people of all ethnicities, but it is more common in people of Northern European descent. Question: Are there any clinical trials for Marfan syndrome? Answer: Yes, there are several ongoing clinical trials for Marfan syndrome that are focused on developing new treatments and therapies. These trials are conducted at various research centers and universities around the world. Question: Can Marfan syndrome be prevented? Answer: No, Marfan syndrome is a genetic condition and cannot be prevented. However, early diagnosis and treatment can help prevent or delay the onset of serious complications. Question: Can Marfan syndrome be inherited? Answer: Yes, Marfan syndrome is inherited in an autosomal dominant manner, which means that if a person has the condition, there is a 50% chance that each of their children will inherit the condition. Question: Is there a cure for Marfan syndrome? Answer: Currently, there is no cure for Marfan syndrome, but treatments are available to manage symptoms and prevent or delay complications. Research is ongoing to develop new treatments and therapies that may eventually lead to a cure.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.